Okay guys, Revo PT back with another video. Today we're going to be talking about gait mechanics. When we think about gait mechanics, we think about hip flexion, knee flexion while you're running. This is something that we have a really hard time seeing with the naked eye. We can watch people run outside or run on the treadmill, but we like to break it down with a video analysis. So as we go through this process of just looking at the very basics of our gait analysis, we want to proceed with the understanding that we absolutely have to have full range of motion, hip, knee, and ankle to make any of these techniques that we're going to talk about really work. So we're going to take a couple minutes, go through each various phase, and talk about a couple things that we look at in each phase. So here is a gait analysis report that we use with our athletes. There's a lot of things here, so let's orient you. Here's a still of initial contact, peak knee flexion, push off, and flight. Here are their corresponding ranges of motion at the trunk, hip, knee, and ankle for initial contact here, peak knee flexion, and etc. When we look at a gait analysis, what we're really paying attention to is the energy absorption phases, specifically initial contact to peak knee flexion. We see a vast majority of musculoskeletal pain show up during these phases versus energy generation. So we're thinking push off and flight. We pay really close attention to all the whole body positioning during initial contact and peak knee flexion and see where are you absorbing impact and where may you be overstressing in certain areas. So as we go through, let's take a look at initial contact. First thing we want to pay attention to is the trunk angle. Vertical is, are you leaning posteriorly, which equals a lot of braking forces. Hip flexion, knee flexion, and ankle position. It's nice for us to know these static measures, but what we care most about are the excursion or change in range of motion from initial contact to peak knee flexion. So as we look at this column, which represents the excursion, we see a 5-degree increase in trunk lean, forward trunk lean. We see a loss of some hip flexion, and we see a nice gain in knee and ankle range of motion. So when we see that increase in range, that represents energy being absorbed at that joint. This would definitely fall under the quad dominant or knee strategy. So we're thinking we're loading up the quad and patella a little bit more in this specific example of gait versus the hip and the glute max. As we look down here in some of these loading areas, we're seeing trunk lean is nice. We don't have necessarily gait normative values for running, but we do know that we want to, if this athlete is feeling some anterior knee pain or Achilles pain, if we can pull that knee and hip a little bit posterior, we can offload stress at the anterior knee and then down here at the posterior ankle. When we look at all of these measures and we think about what we need to do to correct some of these patterns, we want to go back to basics. Full hip range of motion, full knee range of motion, full ankle range of motion. Without that, we're going to really struggle to make movement patterning changes. Body is absolutely designed to have full range of motion, instant access whenever it needs it. Body's always going to take the path of least resistance. So if we skip forward to push off and flight phase, in this athlete, like most runners, we can see a little bit of anterior pelvic tilt here as the hip moves into extension. And that's where we can link back to having full hip extension. If you don't have instant access to 15 degrees of hip extension, we'll often see that excessive anterior pelvic tilt can increase lumbar lordosis, and then as we move through to the next phase, can make it difficult for the glute to remain active when we get into initial contact. Certainly, the faster you run, you're going to see some lumbar spine extension and or anterior pelvic tilt, but we want to ensure that the hip mobility is there in the first place. So when we talk about more excursion here at the knee from initial contact to peak knee flexion, we see a 19-degree change. That's great. if this runner was experiencing anterior knee pain, which we see a position like this commonly with anterior knee pain, what we're really striving for in our movement retraining is to increase hip flexion or move hip slightly posterior and pulling knee slightly posterior to increase the activation levels at the glute max, really offloading anterior knee and quad structures. Now, if we're looking at a posterior view, there's a couple other things that we like to look at. I'm going to pull in a video here. Posterior view, most specifically, we're paying attention to pelvis angle and trunk angle. So this runner, when she is in right stance, we'll pull through here. And right there, we'll see lateral trunk lean, so almost 14 degrees and 11 degree pelvis angle. Sorry, trunk lean's a little less than that. Basically what we're seeing here is this athlete is dumping torque out of the hip, not using glute med specifically as much as we like that lateral hip musculature. And this can lead to a whole host of issues. We do see this linked with anterior knee pain. We absolutely see this with IT band irritation. But we go through to the other limb. Let's see. We'll call it 5 degrees in left stance. Really, that asymmetry is the biggest problem. Yes, we care about these numbers at their end range, but we really want to get right limb versus left limb fairly symmetrical. And then back to right single limb stance, we can see that increased pelvic drop again. So these are just some really basic measures that we look at in Gait. There's certainly much more fine detail that we can look at to tweeze out various injury risks, but we want to ensure that all folks are having full hip, knee, and ankle range of motion. And you can go back through our other YouTube videos to see lots of mobilizations that we use for all those joints. But we also want to make sure that we can do a really fine-tuned assessment of their mechanics while they're running. The naked eye loses a lot of detail, so use an iPad. If you have a physical therapist in your area that uses software for gait analysis, if you're struggling with your mechanics, go see them. Get a fine-tuned assessment of this. This is going to not only help you tweeze out why are you having pain or dysfunction, but it can also be a great way to measure as you go along, are my therapeutic exercises making an impact on my function?